I finished my 10 weeks of medical training at Fort Sam Houston, San Antonio. Had to leave, got married, 1st of July. I was off to Japan for my duty assignment. Mid July, I arrived at the 106th General Hospital in Yokohama, Japan. The hospital had previously been a barracks built in about 1955. In 1965, part of 66, it was being remodeled because of the escalation of the war in Vietnam, and it was being converted into a 1,000-bed hospital. Towards the latter part of 1966, the hospital began receiving its first patients. The 106 General Hospital is also known as Kashine Barracks. So the first week I was taken around the hospital, shown where the mess hall was, where the post office was, went and received my whites that I would be wearing in my duty assignment as a medical corpsman. Beginning of the second week, I was given my assignment. It was on Ward C2, the burn ward. The 106th had become the burn center for all burn casualties from the Vietnam War, and we received thousands of them during the 3 years I was there. The 3 years that I was in Japan at the hospital, we received over 50,000 patients. And there were wounded in Vietnam, a little over 300,000 patients, of which 152,000 required hospitalization. Our patients arrived at the Air Force Base Yokota, and many of them were brought by ambulance bus to our hospital, and a significant number were brought to our hospital by way of helicopter. And all of our burn patients were brought to the hospital by way of the helicopter. We had thousands and thousands of flight landings from the helicopters. So keeping in mind that I've never really worked on a patient, and my first day on the ward, I was assigned to work with one of the other corpsmen and to go around and see what they did for the burn victims. Second day, I was given my own assignments, my own patients. And I've written a story about that, and I'm going to read it next. Bear with me as I go through this with you. I'm just entering the burn ward to begin my first assignment. I've never seen or touched a patient, let alone one that is seriously burned. Another corpsman takes me around the ward explaining what I will be doing. I can barely hear his voice over the thoughts racing through my mind. I'm seeing patients that are unrecognizable as human beings. I'm seeing a face swollen to the size of a basketball, oozing fluids, no eyebrows, no ears, no lips. I'm scared shitless, wondering what I will be doing with these patients. My eyes continue to look at the horrendously burned young men. I'm trying to grasp what I'm seeing. It's incomprehensible. Third-degree burns over most of his body. That means no skin. I cannot imagine the amount of pain he is having to endure. The patient smells. An odor somewhat sweet from a bacterial infection that can kill him. I see the surgical cuts running the lengths of both arms and legs. Fluid oozes from these incisions and runs onto the saturated sheets, and the wet rings of body fluids continue to expand. I am thinking that if I am ever seriously burned, I do not want to be saved. Let me die in the fire. I would never be able to endure such pain. My second day on the ward, my assignment is to cut off dead skin while a patient is in a whirlpool bath. I only observed the procedure the day before, and I was told that dead skin, dead tissue, harbors infection, and that infection is what kills most burn patients. I take a wheelchair to get my patient. When I get to his bed, he is shaking with fear, knowing what I am going to be doing to him. His chest and both arms have been severely burned. With my gloved hands, I allow him to grab my hands as he enters the wheelchair. I can feel his hands trembling. I can feel my hands starting to shake. The fight or flight battle is going on in my brain. I really want to take flight, leave, disappear, become invisible. I desperately want to back away from him, go somewhere, be alone, curl into a ball, and pretend I am not here. My fight mechanism is struggling, telling me that I need to be appearing strong, be a man. Inwardly, my heart is racing and my stomach is wanting to vomit all that I am doing. I help him into the whirlpool and I listen to his screams as the warm water envelops his raw flesh, augmenting pain that he has never endured in his young lifetime. I leave him to soak for a few minutes, enough time for me to take a few deep breaths and squeeze my trembling hands into fists, hoping that the shaking will go away. With him watching in fear, I open my surgical kit and begin planning to do what I had only seen done one day earlier. I only know that black skin is dead skin and it can cause infection and kill the patient. My mind is like a stuck record, repeating over and over. Black skin is dead skin and it has to be cut away. With forceps, I clamp burned skin and pull it away from his body. I encounter resistance. Am I pulling enough? Do I need to pull more? Do I need to back off when his screams get louder? He screams, "Just kill me. Get it over with." I consciously, hesitantly, carefully start slicing away black tissue on his back. I do not want him to see me. The incompetence I feel, my insecurity, my hesitation. I do not want to see his eyes. Using the scalpel, I cut away another silver dollar size of dead black skin. In spite of the pain-numbing morphine he has been given, my patient screams with each cut that I make. Between screams, he is sobbing uncontrollably, crying, "No more, no more, my God." How can I keep torturing him? Only 5 minutes have gone by and I still have to do this for another 25 minutes, cutting on him, watching blood ooze from the cuts, and seeing patches of dead skin, blood, and body fluid floating on the surface of the water. I quickly remember only 4.5 months ago, I had been a college student, in love with the girl of my dreams. He squirms to escape my continuous pulling and cutting. My mind is in turmoil with confusion. How am I going to be able to do this every day for 3 years? A continuous stream of unwanted thoughts are racing through my mind. I am torturing this man. I can hear his screams. I must cut away more dead skin. I don't want him to die. I have to do this tomorrow, and the next day, and the next day. No one taught me how to do this. I am not prepared. Little did I know at this moment that I would never, for the remainder of my life, be able to forget the screams, nor erase the mental images of my patients' grotesque disfigurements and their cries for relief. So I've read to you my story, and I want to present to you an interview by one of the burn victims that we had on the ward. Sergeant Alan Rowell was injured when a bulldozer that he was driving went over, I believe, a landmine, and it ruptured the transmission, and the transmission fluid was thrown up over his body. And so you can hear how he perceived the treatments that we corpsmen had to give to him. It's quite illuminating.
And then you went to the burn center after that. And that is an area I would not send my worst enemy. You have to be a special person to even work in one of them. We got into the burn center the first day you come in my arms, you couldn't tell where my fingers were. They looked like a big balloon down here. My arms were about that big around. And you went in and just put small cuts everywhere. And then they take you back in a feather bed, put you in there, and they hang your arms up on IV poles. In the morning you wake up and you've got pus and liquids everywhere. In the morning they take you in and they sit you in the, we call it the horse trough. It was like a big, that you would see on the farm, full of water, and they put you down in there and there's a cradle in there. And they soak you in there while they're working on the person next to you. And after they get done with him, they put the salve on him and he goes. Well, then it's your turn. They pick you up out of there in the straps and sit you down in the one over there, and it softens that because it gets hard overnight. And they actually, I always said it looked like a butter knife. They just scrape it. And you got to remember, this is all raw. And they scrape it down. And when they get it off, any scar tissue that forms, they literally take a pair of tweezers and fillet it like a fish. You know, it was the awfulest thing I've ever went through in my life. But you see, these hands work. My arms work. In the next chapter, I'm going to be presenting to you my experiences working on the orthopedic ward for 2 years, 9 months, and 19 days. I worked with thousands of patients. Triple amputees, double amputees, single amputees, multiple gunshot wounds, fractured femurs, bone loss, infected wounds. So join me in my next chapter as I deal with orthopedics. Remembering that in Hawaii, we say aloha. Aloha. Hello, goodbye, peace, love, compassion.